The federal government, through the Basic Healthcare Provision Fund, BHCPF, has approved the disbursement of 25 billion naira to the National Primary Healthcare Development Agency, NPHCDA, and the National Health Insurance Authority, NHIA, in a move to strengthen access to primary health services and infrastructure across the country. According to Professor Muhammed Pate, the Coordinating Minister of Health and Social Welfare, during the 6th meeting of the BHCPF Ministerial Oversight Committee held in Abuja, he disclosed the allocated funds were earmarked for direct facility financing and workforce incentives across the state. Now, he also stressed the essence of the initiative and announced the disbursement process will be facilitated through the NPHCDA and NHIA agencies' gateways to all states to improve the capacity of about 8,000 primary healthcare centers to provide services. The minister explained that guidelines will be revised to cover health services rendered to the indigent population while aiming to reduce maternal mortality rates, out-of-pocket payments, and standardized healthcare quality across primary healthcare facilities. And we're joined this morning by Dr. Francis Ohanyido. He actually is the Director General, West African Institute of Public Health, Abuja. So good to have you join us this morning. Does this seem like good news to you? Were you happy when you did see the figures, and did it make you feel some type of way?
All right, thank you very much. I think it's interesting, and well, let's say kudos to the government for even making the effort, because I know after 2014, when the National Health Act was passed with the inclusion of Basic Healthcare Provision Fund as a component of that, for 2 years, I think the Buhari administration didn't even bother financing it. It was quite a problem. But now there's been a momentum in financing it, and I think this is a good movement. But last year, we were made to understand that in this first quarter, that what will be released for or allocated for the Basic Healthcare Provision Fund will be in the region of 50 billion. So what we're seeing is about 25 billion, which is about half of that. But then still, that's something. But bear in mind that the Basic Healthcare Provision Fund is not really the main budget healthcare system for Nigeria. That is about 1.33 trillion naira for the sector, and that is still a far cry from the Abuja declaration, because this is about 4.6% of the national budget. So for the Abuja declaration, which Nigeria hosted in 2021 and 2001, we agreed with the African Union and other countries that were signatories of that declaration that we earmark an annual budget of about 15% of the national budget to healthcare, because healthcare is also a driver of GDP. And if people are not well, they can't give you the best in the economy. So seeing that the government at least is putting 25 billion this quarter to begin the process of revitalizing 8,000 health facilities, primary healthcare facilities. Bear in mind that there are about 30,000 of them, and only just about 25% of them are actually working in one form or the other. And I also understand from this government that beyond that 8,000, they want to double it between now and probably 2026, thereabout, to be able to ensure that more of those more of those facilities are working. That's a double of those numbers. And that is very important, because the truth of it is that if we are going to deliver health services for Nigerians and do it right, it has to be gated through primary healthcare. And Obasanjo should be able to walk out of a farm, 10 minutes walk to a primary healthcare center and be treated for uncomplicated malaria. That's how it should be. If we are not there, then we're not there. And the more we're able to mobilize resources for the health system, the better for all of us. Because without health, there's no wealth for all of us.
All right.
Okay. I think that it's very important to have this conversation. You've talked about how healthcare can drive the nation's GDP. Now, talking about this fund, some would argue that it's not just about the disbursement of funds, but rather how the funds are applied. Are there worries and concerns about the application of these funds? Are there concerns about corruption maybe affecting how these funds might be disbursed?
Yeah, of course, there are concerns. Let me say that I was privy to development of the National Health Act. when it was passed, I was a senior technical consultant to the majority leader of House of Reps, and I was part of the process of the evolution since as far back as 2004, in one form or the other. And it's been an interesting thing. It was supposed to help galvanize Nigeria towards universal health coverage. And how this fund, originally, the Basic Health Protection Fund had 3 gateways, and these gateways are supposed to be gateways that move the money straight to Ministry of Health, to NPHCDA, National Primary Health Development Agency, and then the National Health Insurance Service, which health insurance has 50%, NPHCDA has 45% of it, and then 5% of it was for the gateway of the Prime Minister of Health. Yes, there have been challenges in the sense that over time, there has been tendency to turn this Basic Health Protection Fund more into a project than a program. And there's a difference between that. In terms of project, the structures for project that now in Ministerial Oversight Committee and certain structures and appendices that came into the minister's office, if they are working and doing what they are supposed to do, good and fine. But that has also raised issues among stakeholders, because originally those structures were not supposed to be part of the original design of the Basic Health Protection Fund. So, but there's need for some form of oversight, but it doesn't need to be converted into a project system for an oversight. Because the problem with that is that sometimes it creates its own bureaucracy and also creates its own inefficiency within the system. Originally, because the Basic Health Protection Fund is a first line charge. What it means is on the statutory transfer of the Federation, is along with things like defense and other budgets, so that nobody can touch it. That's the whole idea about the Basic Health Protection Fund. And that's why it's outside your normal budget of the health sector. So it's such that it should be able to come from the central bank into those 3 gateways and get to be operationalized by those entities that are receiving them. So there have been certain things that have been done along the way to this. But one thing that is good here is that I know Prof. Pate is a good friend, and the good thing here is that he's using a sector-wide approach, which means he's trying to get pooled and unpooled funds into this sector that will help drive the Basic Health Protection Fund. If you remember, primary health is on the concurrent list, and the problem with health has been that it's almost like a baby that nobody owns because it's on the concurrent list. And one of the reasons why the Basic Health Protection Fund was put there in the first place was for federal government of Nigeria to show commitment to revitalizing primary health care, which most of the stakeholders tend to see as being in the purview of the local government. And that has been one of the reasons why primary health care has really suffered. Some of the governors use the apron string of the state to colonize the money of primary health care. And because of that, those primary health care centers don't get the kind of funding they need. So what has come here is a sort of a catalytic fund at the federal level to support the subnational to be able to do more work around primary health care. So that money really is what it's supposed to do. Part of is within their considerations and the mandate of those units that receive those funds. And like the NPHCDA, part of it is also to help revitalize the primary health care centers. So if the 25 billion is released and is effectively used, it will help to revamp some of those 8,000 facilities that the government is doing. And that is where the problem is. One of the biggest things in the health sector is hemorrhage. We need to tighten the system so that we get more health for the money we put inside the system. Because one of the challenges we've had in the system is that we're not getting the kind of health that we put the humongous amount of money. And that's why a lot of Nigerians, over 60 to 70% of Nigerians are using out of pocket expenditure to finance their health.
All right. I mean, you've broken it down for us one way or the other, helping us see the benefits as well and what Nigerians stand to gain. But then again, I mean, to just wrap things up very clearly, in the past, we've seen budgets being passed, and while these budgets are being passed, we've also seen allocations being made to the healthcare system. Sadly, as it is, Nigeria's healthcare system is still in no way compared to what we have in other climes or country as well. What is needed to be done to ensure that this 25 billion that's about to be injected will be able to meet the needs, of course, give us international standard medical system or facility or things that would enable Nigerians to benefit from it?
Okay, the truth of it is that 25 billion is too late for our health system to be as a galvanizer of primary care system. We need more than that. We need at least for the health budget, which is at 1.33 trillion, we need about 3 times that amount to be able to position our health system. But that said, the health system suffers also the issues of poor accountability in certain areas, and then there's hemorrhages in that system. So that even some of this money that gets into the system don't do the work they get to do. So you find out that some of this money is, like you pointed out, become a waste in themselves, So at the end of the day, it's embarrassing that sometimes in the past, sometimes the ministry returns money that it has not been able to spend because of poor absorption capacity. So we need to really think about how we do these things right and do them well. So that, in a sense, that this money that goes into the system gets to do all the work it needs. Like I said, 25 billion is small, relatively, but it's an effort on the part of government, better than, like they say, half a loaf of bread, better than none. But the point remains that in order for this money to be as catalytic as it should be downstream in primary healthcare, we need civil society to track this money, to follow this money, to do this budget tracking around this money and follow it to the facility level and ensure that this money is used. Until the civil society becomes a voice for accountability and is able to track this money and make sure they're effectively used within the health system, we will continue to be going around a kind of missionary journey that we cannot explain to even our own children. But that's very important. Like you said, we need to be sure that this money will do the work it's expected to do. And that's one of the ways we can do it. Accountability system, where non-state actors are part of the process and are able to also watchdogs of that system.
Well, a lot to unpack from this discussion, and it excites my heart to know that you've said we need more. And why I say it excites rather than make me feel down is because it shows that we have a long way to go, and there's a pathway that we can actually follow through. But you know what? We look forward to bring you back again so we can have this discussion further, and then we'll get to see what the 25 billion naira has done for us. Thank you so much for joining us, Dr. Francis Ohanyido, all the way from the Federal Capital Territory.
Thank you very much.
All right.